So I'm here to talk about your carotid surgery, which has been recommended for you. And the reason we're doing carotid surgery on you is because you've had either a minor stroke or the disease in your carotid artery has become so severe that you are at risk of having a stroke. So we need to prevent a debilitating stroke that may result in a completely paralyzed person. Now, in regards to the carotid artery, as shown in the diagram, there are veins and arteries. The veins are the blood that's returning to the heart. Those are the blue. Arteries, which is what we're going to repair, are the red. This is the oxygenated blood that's going from the heart out. And the carotid artery is the red artery in your neck that feeds the brain. Okay, now here's my diagram of, again, the carotid artery. From the heart, the blood vessel that comes off the heart is called the aorta, but the blood vessel that leads up to the brain is the carotid artery. At the jaw level, it'll split, one going to the face and one going to the brain. It is this area, right in this area here, that usually gets disease. So if we look at a blown up version of this, this represents all the plaque. It's usually right where it splits. Now, as blood is coming up, it may form a piece of clot, or it may break off a piece of the plaque, which will then be carried up to the brain, causing a stroke. We need to prevent that. And how do we prevent that? There's two ways. The first way is surgery, where I will actually make an incision in the neck, get down to the blood vessel, clamp the blood vessel so there is a bloodless surgical field, open up the vessel so I can see directly inside. So at this point, once I see directly inside, I will then actually clean the plaque off the vessel wall. So you're going to have a vessel wall that's open, but now it's clean. And this opening, I will actually put a patch on this and sew it on just like this with the sutures. So the vessel is bigger and cleaner. And typically, then you're done. Now, what are the risks associated with doing the procedure? Well, first and foremost, if you don't do the procedure and you've had a mini stroke, your risk is as high as 25% of having another stroke, all right? If you have not had any type of symptoms, then it's about 10%. But what's the risk of surgery? 1%, 2% in people who have done many of these surgeries, all right? So when the risk of surgery is far lower than the risk of treating it medically or conservatively, surgical is the best option. But what are the risks associated with surgery other than stroke? And these are the things that you have to remember, okay? All right, we talked about stroke, but that's only about 1% to 3% in the best hands. Heart attack, but what we do is that we have you see the cardiologist to make sure your heart's okay, to make sure that we minimize any type of heart problems during the procedure. So heart attack, and that's very low. Bleeding in any surgery, right? If you bleed a lot, that's an emergency, but most of the time we'll know if you're going to bleed typically within the first 24 hours of that surgery. And the last thing that you can also have to worry about is that you can actually have some numbness along the skin, all right, along the incision line, which is typical. You may have numbness either temporarily or permanently, but that's usually not a paralyzing or a functional defect. It's just numbness along the incision line. It's kind of expected. You can also expect some puffiness, normal, and a sore throat. Other than that, the stroke, the heart attack, and the bleeding are definitely things that you need to be aware about.